Face to face, eh?
Karibuni. Hi everyone. Welcome to webinar. Karibuni sana. Thank you. I can see Mudoni. Welcome from Nairobi. Karibu sana Peter. Tuo, thank you, karibu. Can see you, welcome. Karibu, it's 7. Our meeting will start at 7:05. Continue joining. Karibu sana, Joy Makau. I can see you. From Eldoret, thank you. Karibu webinar. Hello, thank you. Lori Kome. Karibu. Thank you. Karibu Simon Mwanki from Nakuru. Karibu. Nice to see you. Mutua, karibu. Dr. Karanja from Kisii, you're welcome. Welcome. Karibuni. Continue joining. I can see you. Hi, everyone. Thank you. Welcome. Karibu. Our meeting will start at 7:05. We are continue welcoming the members. Thank you, Dr. Jamai Machakos. We recognize you. Thank you. Karibu. Eunice Karithi from Kikuyu, karibu. Karibuni, welcome, welcome, welcome. Karibu. Welcome, continue locking in. I will start at 7:05. So we are remaining with 1 minute to begin. Welcome, welcome, 1 minute to begin. Welcome, karibu. Remaining seconds to begin our session. Those who are joining, continue joining. We are waiting for you. Welcome. We want to begin our meeting 7:05. Those who are joining, continue joining. Our session begins now. I'm Cedric Shiveka, the psychiatric nurse. Our today's topic is about masculinity and mental health. I hope it will be be good for you, and will enjoy the topic. I would like to acknowledge the following association present in the session. I'm acknowledging the Kenya Medical Association, the chair, Dr. Were, Kenya Medical Association CEO, Dr. Njoki, present. Medical Psychologist Association of Kenya, present. Karibu. Clinical Psychologist Association of Kenya, karibu. NNK, National Nurses Association of Kenya, all the members and all the stakeholders, welcome to the session. Kenya Clinical Officers Association, karibu, welcome. Kenya Health Professional Association also present, we recognize you. Kenya Psychiatric Association, welcome, Dr. Ohas, karibu in the house. Kenya Medical, Pharmaceutical and Dentist Union, you're also welcome. We have begun our session. I will be the moderator today. Our topic of today is masculinity and mental health. Then all the members, you are free to ask questions, to comment, and also to suggest the future topic that we will discuss in future for our webinar, mental health. It's also always carried on Tuesday at 7 and ends at 8. Members, feel free, welcome. You can comment, you can ask questions in our QA, question and answer. Our presenter of today is Dr. David Bukusi. Let me short history about Dr. David Bukusi. Dr. David Bukusi will take us through this interesting topic of today. Let me read a small history about Dr. David Bukusi. He's a medical doctor and working around the country, as well as working as a psychiatrist at Mathare Hospital in Kenya for over 10 years, managing mental health and general psychiatry. He subsequently moved to the Kenyatta National Hospital, where he practiced liaison psychiatry for another 3 years, with a special interest in disaster management, participating in managing acute stress and post-traumatic stress disorders. During several international trauma response tours for victims of both national and international disasters in Kenya, Cote d'Ivoire, and Sierra Leone, with the United Nations bodies of the continent. Dr. David subsequently worked in setting up the Kenyatta National Hospital medical response to HIV and AIDS. Dr. David ran the youth services at the Kenyatta National Hospital, addressing contemporary challenges in health services, provision for youth, including social and psychosocial health, parenting, also psychosocial health, and also substance abuse in relation. Dr. David is currently involved in research around HIV, HCV, and IDUS, depression and interpersonal therapy, as well as masculinity, mental health, and suicide. He's also adjacent lecturer in clinical psychology and at Taista University and at the University of Nairobi in the Department of Psychiatry. So I would like to welcome our presenter, Dr. David Bukusi, to take us through this important topic of today about masculinity and mental health. I hope you will enjoy our topic of today. Dr. Can you get me? Are you getting me?
Yes, I can.
Yeah,
yes,
you can continue, Dr.
Thank you very much. Okay, let's jump straight into it. We can. We've got quite a bit to cover today. We've got about 40 minutes, and I'm going to be looking at masculinity and mental health. An intriguing topic in and of itself, just having to try to tease apart what it actually, this masculinity creature actually is all about. Our current understandings of masculinity, just to read this particular quote, is very limited. And it's that limited understanding of what it is to be male that may lead us to aggression. By having a limited scope of coping mechanisms, we very quickly go to explosion and aggression. There are plenty of people, I guess, in all sorts of different parts of the world who would be able to identify with this kind of definition of masculinity, where people who are male, by and large, very often supposedly with a limited scope of coping mechanisms, explode when they are when they have challenges. Definitions come in all sorts of forms, but by and large, ladies and gentlemen, whatever a succinct definition of what masculinity actually is whatever a man does to be a man, whatever a man does to be a man. Building onto that, it's a concept that is actually considered socially constructed, usually looking at these particular parameters around the attributes of being a man, the behaviors that are expected of being a man, and similarly, the mentality primarily associated with being a man, masculinity as a concept. And those are the kind of things that contribute to its social construction. The main attributes of masculinity include being a provider and a protector for the family. And this is very key, as we will see as we're talking, as we go through this particular presentation. Emotional restraint, keeping our emotions under check, okay? Dominance, toughness, strength, and self-reliance. Just appreciating these particular attributes, one can even start to appreciate possible challenges that men might go through within the context of mental health. Now, appreciating in most parts of our societies, these descriptors are actually very congruent with men being breadwinners. We need for them to be breadwinners. We need for them to be heads of families. We need for them to be head of corporations, tribes, and all sorts of other social organizations. Now, what we do have to be careful about masculinity is the following. While it is a social norm, this being masculine or being even hyper-masculine, it has led to various negative consequences in the mental well-being of very many men. And these include seeking risky behavior, literally deliberately going out to seek risky behavior, abusing drugs and alcohol, a reluctance to seek out treatment, and being unsure of how to address their need for help. So these are associated with masculinity. Risky behaviors, abuse of substances, reluctance to seek out treatment, and these have been brought out in studies around the world, and being unsure of how and who to turn to when one supposedly needs some help. When some men fail to meet these expectations, and not just men, even the communities, they perceive of the people who have failed as being inadequate and weak, which further perpetuates that particular challenge in terms of trying to be a man. And we shall be looking at how this actually all comes together within the context of mental health. However, the good thing is, because masculinity is socially constructed, it's a socially constructed concept for all intents and purposes. Social, if we address the social issues that lead towards the construction of this particular concept, then it is possible that we can actually change it and have it being adaptable. I just put this here just for us to have a quick look at and appreciate what happens when we have masculine dominated kind of societies which can be described as masculine. Work tends to prevail over family. There's a sense of duty. I need to go out there, I need to do stuff. Fathers should deal with the facts. Mothers, please, you look after the different challenges of these particular children here, but I'm going out, what are the issues so that I can address them? Men, there's great admiration for strong people, for the strong. Yes, that's what we like. There's a disdain for weakness. There's a differentiation in what we expect from our boys and girls. Girls cry, boys don't. Boys fight, and it's allowable. Girls shouldn't. Religion in masculine kind of dominated societies focuses on powerful gods or God. And sex is a way of performing. You can appreciate how these particular values, these particular practices within the context of any immediate environment may significantly contribute to what is expected of a man. Remember, masculine, being a male, doing what men do. And if this is what is understood within your community as what men do, then this is how you're going to behave. And as you can appreciate, obviously there's some challenges which are coming through. Who are these guys who contribute to this concept of masculinity? Now, we live in societies, and within our societies, we have governing structures. Religion has been a big governing structure within the context of developing the concept of masculinity and femininity for that matter. We have very specific expectations, very specific exhortations. If you are a man and you follow this particular religion, this is what is expected of you. This is what you do. There are specific demands that are expected of you, or rather are put to you in terms of how you interact with yourself, interact with your peers, interact with your fellow men, with women, with the community. Religion has a big role to play within the context of masculinity. And even as people have kind of moved away from religion in the current day, a lot of the very basic tenets of our understanding of masculinity came from religion. Tradition, cultural practices, and beliefs about gender. So we have religion on one hand, we have our traditions, relationships within the community, what men do, how people get initiated, all the different cultural practices that contribute towards men being men, allowing us to graduate at different points in time from being a child, a boy child, to become a man, to become an acceptable member of society of a particular level with particular expected responsibilities. And those responsibilities very often are one of those things that men seek, which help improve significantly their self-esteem. But increasingly, as we're coming into the modern age, there's modernity. And it's one of those things that I want to touch on a bit today, so that we have an appreciation of perhaps the contributions of modernity onto the different societal, social environment that we live in, which may have a significant impact on modernity or on masculinity and how it is subsequently practiced. So, as we look at it broadly, modernity, we're looking at the worldviews which have changed from literally the beginning of time, when we were dealing with the hunter-gatherer communities, which have come through over the ages, through the agrarian, through the industrial age, into the ages of postmodernism, which is characterized by deconstructionalism and developmentalism. In other words, we are in a place as societies where people want to break down, want to understand what are the different components that actually contribute towards our society, up to and including ourselves as men, masculinity. We're in an era of developmentalism. We're in a place where we can say, we can appreciate what are our challenges, what are our shortcomings, and subsequently choose to take action in terms of growing ourselves, changing ourselves. In other words, we have agency. In the past, we were responding to different challenges. Now we're in a place of some level of security. We can actually start to grow ourselves. There are those who would actually say we are in the age of the Anthropocene, where we determine how we respond to what it is that's out there, as opposed to being driven by the circumstances that we find ourselves in. Now, further to that, worldviews are changing. We are moving from survival mode to consumerism and pursuit of pleasure. In other words, we are moving from a place where we used to have needs and wants to a place where we have wants. Where we had needs, we very often had to have very clear structures, especially about roles and responsibilities, because if we did not, survival was going to be at stake. But now we are coming to a place where a lot of the major disasters that were a big problem for the survival of the human race have been, in a manner of speaking, conquered. And moving up the hierarchy of needs, we are now getting into a place where we have wants. We moved from needs to wants. And we're going to talk about this a bit more as we look at some of the male behavior and the feminine behavior that impacts masculinity. We're here in a place in this world now where we're talking about the pursuit of happiness. World Happiness Report 2022 came out just the other day. talking about happiness. We look for happiness. Happiness was enshrined in a lot of our constitution. I mean, it was enshrined in the US Constitution. And more it's being accommodated and recommended by different world bodies at government level. Whereas happiness never used to be something to be pursued, so to speak, because what we were looking for was basic survival. Now we're looking at pursuit of happiness. Again, will have an impact when you think about what are the challenges that are the men face, and what are those particular characteristics that they hold dear to that may influence these particular aspects, so to speak, of modern times. So in the context of modernity, where we are right now, socially progressive trends affirming the power of humans to create, improve, reshape their environments. We have scientific knowledge, we have experimentation, we have technology. Things are changing socially. Within the context of the social is the masculine. Modern times encourages re-examination of every aspect of existence, from commerce to philosophy. And I'm highlighting here religion and tradition. Religion and tradition, which have been very much the skeleton of a lot of the masculine practices that we engage in. The idea being we want to tear out or tease out what was holding back progress. We need to move. Nothing is sacrosanct. Everything is up for review, including societal and gender roles and structures. All of these are up for review and discussion. We want to find out how is it that we can go forward. Now, the third thing that has had a very significant impact on men and masculinity has been women's empowerment. Now, women's empowerment has been characterized by women's education, increase of women in the workplace, pursuit of career excellence, sexual freedom and planned pregnancies, and self-sufficiency, independence. Here we are. I remember one of the characteristics I talked about pretty early on about masculinity. One of the expectations was supposedly to be able to look after the family. And here we are, we're having people who are saying, no, hold on, wait, I'm not ready yet to get a baby if I'm going to get a relationship at all. And subsequently, actually, I don't need you. These are the things that bring about some sort of challenges. So I've looked at some aspects of what we define as masculinity. Okay, the different characteristics, the basic characteristics. I've looked at some of the things that influence our characteristics, our masculinity at this time. There's the worldviews which are changing, Then there's a whole thing about modernity which is coming through. So keep these two ideas at the back of your mind as I'm going to go through a more thorough examination of this concept of masculinity. This is based on Rae Connell's classifications of masculinity. She looks at them from about 4 different categories. And it just helps us to have a better understanding of what masculinity actually is. And it helps us also to start to perhaps maybe relate to different components of this masculinity. It has been critiqued, there's no question about it. The world of knowledge is such that everything that you put out there is subject to criticism, but it does provide a useful framework from which we can actually look at what masculinity actually is. Now, hegemonic masculinity. This is the one people love to hate on one hand, and others love to love on another. Because this is a masculinity that will dominate other types of masculinity in any particular historical or social context. The hero, the person who rules by strength, by domination. Qualities include strength, suppression of emotions, like I said, dominance. They are not moved by sideshows, and they are very often seen as the benchmark against which other forms of masculinity are judged. This tough hero kind of first person who has the resources, who has the strength, who will ride out, who will sacrifice his life. Now, it can take many forms, this hegemonic masculinity, and we see it practiced in different places. Patriarchy, supposedly at home, I am the head of this house. Nobody moves until I have breathed, so to speak. Business competition, where it's a rat race and it's the toughest guy who actually wins out. nights out. You know, I go out and I'm the tough guy, and I'm the guy who's buying the drinks. I'm the guy who can tolerate drinks. I'm the person who is still in charge, even at the end of, at the end of the evening. Now, it's important to be able to appreciate that it also may include structures around gender. So, hegemonic masculinity, man has to be in charge. Class is the top class which has to be in charge, and it's that top class which is the reference point. Now, it has brought challenges within the context of race, because very often when people would be discussing masculinity, it would be the white male who would be right at the top of the class, on top of the race relationships, and right at the bottom, you'd probably have the black female. And so hegemonic masculinity works with, lives in, performs within the context of that kind of masculinity. Now, some bit of relief, perhaps nobody ever fully achieves it, but this is, like I said, this is the benchmark. This is a man. This is a true man, because he's able to do X, Y, and Z. So that's hegemonic masculinity, a major reference point. Now there's complicit masculinity, which is perhaps where more men tend to would fall under this particular category. They do not necessarily fit into hegemonic masculinity, but benefit from it and do little to challenge hegemonic masculinity. So you benefit from it from the perspective of, you know what, I'm a man. And therefore you people know what men are supposed to do. So therefore, while the hegemonic masculinity, the person who's hegemonically masculine, shall we say, can impose his dominance, here the dominance is secondary to the understanding of the societal expectation of the man, and therefore they benefit from that understanding, not necessarily being able to actually perform as a hegemonic man. So they often admire the characteristics of that hegemonic masculinity, but not necessarily act on it. Like I said, many people, many men, and they're just, well, they can talk about it in their social gatherings, but not necessarily beyond that. The third category is the marginalized masculinity. A marginalized masculinity. Males who support the hegemonic ideal, remember, dominance, power, strength, no emotions, who pursue a sense of masculinity, but may be minorities in another form. They may be from among the poor. They may be men of color in societies where, unfortunately, men of color are marginalized and other discriminated groups. Now, these are the kind of people who, unfortunately, will store within them all sorts of rage sometimes. And when they do get an opportunity, they will lash out, appreciating what it is they would have wished to be given the hegemonic ideal. The second point I'm just making there is this has also been a response to the decline of traditional male identities and the rise of women at the workplace. So sometimes within the context of these marginalized masculinities, there's a hostility which builds, which unfortunately can be triggered into action at different points in time. So hegemonic, we've talked about the hegemonic, we've talked about complicit, which is where many men fall, and then we have marginalized masculinity. But at the bottom of the totem pole, so to speak, we have the subordinate masculinity. So men who exhibit qualities that are the opposite of values in hegemonic masculinity. And this may be very often lower rank workers, maybe gay men who are literally, like I said, behaving the opposite of those particular values to understand. Instead of being strong, they're being weak. Instead of being dominant, they're being submissive. Those kind of things that we're talking about. Okay, so that's masculinity. And now we want to address it vis-a-vis mental ill health. The concept of masculinity emphasizes toughness, stoicism, acquisitiveness, seeking out for yourself, self-reliance, which is directly in conflict with weakness. And weakness tends to come across as a psychological disorder. Having a psychological disorder tends to come across as weakness. So here you are, you're a man, hegemonic, aspiring to be hegemonic, complicit, or marginalized. And here somebody's telling you you're having a psychological word. No. I don't want to be weak. Now, a quick reminder of what it is that we understand of mental health before now we look at actual scenarios in which we are looking at how masculinity contributes to ill health. WHO, a state of well to realize the normal stresses of life, can work productively, can make a contribution to their community. And this fits in with the understood roles, perhaps one might say, of mental health or of masculinity, because you do want to go out and work, you want to be productive, you can cope with issues and challenges, work productively and make a contribution to your community. You're a family leader. This works nicely, works very, very nicely. Indeed. Understandings of what other people may think about, the mental health is about how we think, how we feel, how we behave, and these are the things that affect our daily lives, affect our relationships, affect our health. But that's our physical health, that's our mental health. But we also acknowledge that mental ill health, depression, anxieties, serious mental illnesses, all of those people do have some appreciation of what they are in the first place. We also do know the signs of mental health: poor sleep, poor appetite, all these sadness, anger, abnormal reactions and emotions, poor school performance, appreciation of what is understood also to be mental health promotion: sleep, reduced stress, exercise, acts of kindness, healthy meals, seeking counseling and support. So I'm bringing this in here so that we can appreciate, we've talked about masculinity, we've talked about the characteristics of masculinity, we've talked about classifications of masculinity, and now we want to match it against mental health, definition, our understandings, and the practices of what we understand as to be mental health. So that's what good mental health is about, and a brief illustration of what can go awry when our mental health is not as satisfactory as it should be. So I want to match some of these things together now. Concepts of masculinity and negative outcomes experienced by men. This came out in a very nice paper which came out a couple of years ago. Looking at, again, social acceptance. Remember, this is a social construct. Social acceptance, which is aligned with the concept of masculinity, being a protector of the family, being a breadwinner, being the head of a family, being a provider, self-reliance, dominant, resilient, courageous, emotional restraint, leader, physical strength, and sexual prowess. This is what we expect. Okay? This is what we expect from any man. Where are we? However, social norms, especially by those who fail to achieve these particular goals, lead men to experience negative outcomes. And this is what we're talking about: drug use, avoidant personality, alcohol use, reluctance to seek treatment, a major, major challenge for very many men. Risky behavior, again, huge. Struggle to share problems. This is what men are made of. Depression, complications of suicide, PTSD, shamed. They're shamed for expressing mental health issues, antisocial tendencies, domestic violence, and others. These are the things which we associate, which very many men associate with failed manhood, But they are, again, be as a result of being unable to cope or manage or achieve expectations of manhood. You're supposed to be a provider. Are you providing? No. You're supposed to be self-reliant. You're not providing. You are supposed to be a protector of the family. You're supposed to be resilient. You're supposed to be the head of this home. You're supposed to show emotional restraint. This is what is asked of you. And these are the consequences that you get as a result of that not working out. And so some of the different kind of illnesses that we end up having, context of ill health, pervasive anger. And you will find this, again, you will find this especially, among us, the whole slew of of classes of masculinity, but much more so within the context of the marginalized. Pervasive anger, and it just needs a trigger and it explodes. alcohol and substance abuse, depression, suicide, violence, addictions, failure to thrive, all or nothing, pornographic addictions, poor relations. These are things that will that will come out within the context of the mental ill health as a result of not necessarily achieving your goals within the context of masculinity. So I want to now just look at a couple of studies which have looked at this particular concept, by the way, mental health and masculinity. And I'm going to describe here very quickly a particular tool that has been used to have that measure put in place. Conformity to masculine norms inventory. Conformity to masculine norms inventory. CMNI. Pretty interesting tool. The original tool is a 94-item instrument, but we have a 22-item instrument. And it measures on a Likert scale an individual with regard to work, these attributes. These are the masculine norms around work, around risk-taking, around dominance, around heterosexual presentation, around emotional control, around winning, around power over women, around pursuit of status, violence, being a playboy, and self-reliance. Significant, appreciated masculine norms. Okay, now it is also appreciated this particular tool was developed around the masculine norms which are dominant in the Western culture. Something else which would be interesting just to discuss when we talk about Western culture, we have a lot of Western culture which has permeated into our lives here today. So a lot of these things actually still in our local context make sense. Work, risk-taking, dominance, heterosexual presentation. I must present myself as a man. Emotional control, winning, power over women, pursuit of status, violence, being a playboy, self-reliance. Self-reliance. So a particular study, this was a paper published last year, association between conformity to masculine norms and depression. And it was looking at the age effects from a population study of Australian men. Which had very interesting findings, looking at a particular age group of men between 15 and 55. Now, it was looking at 3 different particular areas where they had some results. Self-reported conformity to masculine norms. So they were given that tool and they ticked off where they thought they actually fit. Now, those same particular men were then assessed using the PHQ-9 for current depressive symptoms. And then on top of that, we had a self-reported 12-month history, 12-month depression history, looking back at themselves over the preceding 12 months. So they were divided into these particular age groups, 15 to 17, 18 to 25, up to 51 to 55, looking at self-reported conformity to masculine norms, current depressive episodes, and self-reported depressive history. Self-reported depressive history. And there were some pretty interesting findings. And if you think about it, maybe they were not too surprising per se. The younger adults, I've written here 10, but it should be 15 to 35, were found to score higher on factors assessing violence, risk-taking, and winning. Younger men had no problem saying, yes, I do violence, I do risk-taking, and winning is everything for me. Now, they were also found to be more gender conforming to masculine norms. This younger age group will conform to the masculine norms more than the older males, much more so the older 50s, who perhaps over time have realized, you know what, I can't keep on doing these kind of things. These things are a bit of a risk for me. And perhaps they don't have the physical energy to keep on asserting their dominance and things like that. On the other hand, the middle-aged and the older men scored higher on measures of self-reliance. You've come to a place where perhaps you now start to understand yourself and you can put your emotions under control instead of getting angry all over the landscape at things that are happening around you. Now, 3 interesting findings again, 3 further findings. Conformity to masculine norms decreased significantly with age, which is essentially what we've just looked at. They decreased with age. So in other words, literally the people who aspire more perhaps to hegemonic masculine characteristics tended to be those people who are late teens, in their 20s, in their early 30s. But as you started getting older, perhaps again as a result of changes which have taken place within you physically, dominance, financially, your achievement, you've become a family member, you're relating to other people, conforming to those masculine norms reduced. Now, models predicting depression generally showed that higher conformity to masculine norms, remember they did the PHQ-9, higher conformity to masculine norms was associated with an, excuse me, an increased risk of current depressive symptoms, especially in the older group. So people who are in the older groups, if you keep on insisting that this is me, this is what this suggests, that there was a greater likelihood of depression in that particular age group. I mean, well, across the board, but it came out very clearly, much more so in the oldest age group. Persistent insistence on conformity with masculine norms was associated with increased risk of current depressive symptoms. Now, further to that, higher conformity was associated with a decreased likelihood of self-reported 12-month depression history. In other words, the more you conform to your male norms, the more likely you are going to say, no, I have not been depressed over the past 12 months, because that is associating with weakness. So you conform, you're much more of a masculine man, and therefore you will not accept weakness, which depression kind of represents. Okay, so that was just a slight presentation of what we're talking about. I can see we challenged a bit with time. So men are intrinsically, this is now working towards a conclusion, trapped in this particular mold. You see, this particular study was just carried out just the other day. We tend to be given our understandings of what we are supposed to be as a man. We're trapped very often. Men are trapped within the mold of what it is that they understand a true man to be. But we're saying that these things can change. This is what we're saying. These things can change. And we need to have work around society, work around changing what masculinity is. It is socially constructed. And in order to do that, we need to start conversations. What can be done? Stigma around mental health is a big issue, and especially for men. Once again, because it will suggest, if we're looking for mental health concerns, care, it suggests we have problems and we cannot afford to be judged as being weak. Men who closely associate with traditional masculine norms, less likely to disclose problems to others or seek assistance. Traditional norms are more pronounced in particular communities, especially those which are economically deprived. Now, unfortunately, therefore, they cannot even go and seek help even if they actually want to. So is there something just to be able to appreciate? But what it is that has been shown by a couple of other studies is that we need to approach men and the whole issue of masculinity differently, perhaps than we do with women. We target addressing stress through activity. We need to be able to think about humorous techniques. We need to reword our terminologies. And most definitely, we need to have a stronger understanding of culture and men, especially when treating mental health. And in order to be able to assist us to be able to do this, and before we look at what can help us look at this, we need to also continually appreciate what therefore are the challenges of masculinity, even as we are thinking of we want to change the conversations around what masculinity constitutes. Men go through these particular challenges. I want to be a good son. What does that mean? I want to be a good father. And by the way, fatherhood. I cannot emphasize that enough. Extremely important in putting down the blueprint for what a man is within the context of their children, both sons and daughters. A good husband, a good partner. What does that mean? A good friend. I need to be a peer. I have my buddies. A good man in the community, and still, while doing all that, being a real man. Like I said, change our terminologies. Let them appreciate current, present social norms, but make it more palatable for men. An example was done in a particular study in a particular college, which was doing male fields, auto mechanics and welding classes. And they sent out 2 different brochures addressing mental health. Well, the target was mental health issues. The first brochure was talking about, we're doing counseling, you come, we can be supportive, we can listen to what it is you're dealing with. The second brochure went out using terms such as we're having consultations as opposed to therapy, and was emphasizing themes such as self-help and achievement. And what was found, perhaps not too surprisingly, was the people who received the second brochure, you want to go and consult about some things that you are having some challenges with, and therefore you'll be given skills to be able to address them, self-help and achievement, not counseling because of the different challenges and issues that you're having. These are the things that we need to keep in mind. Help seeking, we need to reframe that so that it can be perceived as a strength. We need to talk about help seeking as a means of regaining valued male attributes, which includes moving from dependence to independence. And those are things which speak to very many men and their masculinity. Therapeutic exercises have to go beyond talking, incorporate practical exercises. Those have been seen to make a lot more within the context of mental health in redefined masculinity. One of those things that we show, deliberate guidance in the new challenges of masculinity, especially in this world of modernity, in the world of urban, I very often like talking about, and modernity are huge challenges because they upset the apple cart of previously understood characteristics, practices of being a man. For the older folk, it's different because they've come through a place where they had different ideas of masculinity. Now they have new ones. So they have to break down the old beliefs and support and teach new ideas around masculinity for the younger people coming through. For the younger folk who very often are baffled what's actually going on, for the aspect of fatherhood, deliberate guidance, seeking help, not necessarily a big issue or a big thing for very many men. These are the things we need to rethink about. We do have programs which are out there, Promundo programs, which are men helping men to become better men. Association of Psychologists, the American Psychologists Association, who brought out a program about helping men and boys. It had a big uproar because there are quite a number of people who had some issues around it, but at least it's something that's there. Fatherhood programs, Men Engaged, Promise Keepers. This is out there in terms of helping men become better men, being able to deal with their masculinity and therefore addressing their mental health issues, whether it's mental health promotion or mental health care. Now, very quickly, I just need to rush to this. What else is out there? Toxic masculinity. Masculinity to the extreme, where it becomes a weapon against those who are unwilling to subscribe to behavioral control by gender roles. That's usually where it comes through. Harmful job position, don't cry. Failure is not an option. There are quite a number of very, very tough circumcision rites and traditional practices, which, well, literally toxic. Many studies have looked at appreciation of gender roles within the context of marriage, rigid gender norms in the context of marriage and family, and these very often contribute towards violence in GBV. For those who do not, who believe or perceive of themselves as not being masculine in and of themselves, intimate partners are an easy target for abuse. Then we have the growth of anti-women's groups, involuntary celibacy, incel, appears on many hate forums, where associated anger against women, right? They believe in the rage and the right and the perverse pleasure in dominating women. One of the challenges here is that the incels, perhaps not being the hegemonic man, feel the system discriminates against them because they are not hypermasculine, and therefore they need to find a way to dominate. And yet they are being denied because all the women are supposedly going for the hegemonic men. And so they transform their anger into all sorts of acts against women. Then there's men going their own way, once again, talking about the demands put on men now by women, especially within the context of modernity, in the context of the empowered man. Again, contributing to the self-esteem of what men feel they are and what they're supposed to do. They're supposed to provide. This woman is earning more than me. They're supposed to protect. She's always running to the police. She, you want a baby to procreate, she's going to look for a donor. I mean, all the roles that you were supposed to practice are being scrapped. But we also need to be able to appreciate that masculinity is not just the behavior of men, it's masculine behavior as defined by the society, as constructed by the society. And so you find women working hard, climbing corporate ladders, drinking hard, playing hard, but they also subsequently exhibit the same attendant ill health that men who perform the same also get. While on the other hand, we're having more and more men toning down their masculine behavior, sometimes earning reduced respect from both men and women because they have chosen to become to become, in a manner of speaking, almost marginalized. And they're supposedly in touch with the feminine side, settling for fulfillment rather than successful achievement, climbing of corporate ladders. They'll say, look, I need to just be more nurturing. And on one hand, it may provide some health, but on the other hand, it may also provide its own challenges within the context of functioning. Again, bell hooks, I'm talking about there's been a growth of masculinity studies, and people need to read around some of these things because they are talking about really, really useful things which we can use within the context of providing care, of understanding masculine behavior and how we can best provide support. Bell hooks, this is a wonderful lady who died just a couple of months ago, writes a lot about Black masculinity and how young men are trapped. They are rewarded for their hyper-masculine hypersexuality and violence in society. And yet that same society will commit them to jail or they will just die on the street anyway, they'll be shot. It looks at all sorts of very interesting things. There are quite a number of other authors who have listed there. Many countries are now looking and setting up boards to study men and masculine behavior, study men and masculinity and the context of mental health. Like I said, there's quite a lot of other things going on there, therapy for boys, man enough programs, and what it is that we need to be able to appreciate as my last statement within the context of this masculinity and mental health. Victory is not to the strongest, nor to the swiftest, but it belongs to the most adaptable. And I am sure social constructs, we can work at reconstructing what it is that we understand as masculinity with a view to addressing a lot of the mental health needs within the context of men. Thank you very much. I will end there. Cedric?
Yes, Daktari, I'm getting you.
I'm back to you.
Yeah,
thank you.
We have 3 questions to answer. Allow me to read it for you. Daktari?
I can hear you, yes.
Question 1, what are the aspects of masculinity that can promote mental health?
Okay, yes.
Yeah. Question 2, can I continue, Daktari?
Yes, please.
Question 2, what is the link between homogenic masculinity and being an alpha male?
Which one? Homogenic.
Yeah.
Yeah.
Question 3, opening up for some men is a challenge.
Right.
What's your advice on how they can handle this?
Okay.
Yes, Daktari. Karibu.
Hegemonic masculinity and alpha male. That is, for all intents and purposes, one and the same thing. The dominant male, the person who doesn't show any emotion, physical strength, determination, always heading in a particular direction, always having the right answers, always being able to help when they can. That is, for all intents and purposes, the hegemonic masculinity, the alpha male, the person who has it all, strong, attractive, wanted by everybody, supported by men, women, young and old, and able to do what needs to be done in order to achieve particular goals. And those particular goals are providing, protecting, procreating. Okay, those are the key roles expected of a man. And in the context with regard to your first question, how do you be able to achieve this? Provision for yourself, for your family, that's the bigger extension. Protection, again, of your family, your society, being able to keep the society going by procreating. Those are the expectations. Can those be carried out within the context of a renegotiated masculinity? Absolutely, absolutely. With the understandings that people may have, a man and a woman, for example, or a couple who's working together, or you're working to within the context of a particular family. How can I provide? Previously, I was the sole provider as the man, but now other people are providing. And as other people are providing, therefore, perhaps decision-making may now need to start being shared. Something like that. Protection is the same kind of thing, appreciating what other people bring to the table. And I guess to some degree, that may be a key role of renegotiated masculinity, appreciating what other people bring to the table. And it's not just you, so that you can be able to achieve the goals of your particular family, your particular society. So that was the first and the second. In terms of opening up for men, one of the things that we have seen, like I said, like you captured in my introduction, I've been doing men and masculinities and mental health and suicide. And I've been studying some populations within the context of hospitals. And opening up is a strange place to go, it would seem, for very many men. However, I mean, and they do want people to listen to them, by the way, please make no mistake. But it seems that they would prefer a particular structured manner in which that is actually done. One in which there'll be a lot more possibility for setting of tasks and setting of goals, and appreciating that certain things will not necessarily be achieved, but just putting in place a task-oriented recovery program or adaptability program to whatever it is kind of challenge that they're facing. They seem to be happier and more comfortable with that than just supposedly getting in touch with their feelings. Does that make sense? I hope. You can have a session where, yes, you're getting in touch with your feelings. In the manner of speaking, you're feeling bad, you're feeling sad, we're going to help you. But on the other hand, you can be told, look, this is your situation. And this is what we think will help you. And I saw this has been seen, I guess in other places, it's been seen as well, by groups of men who will come together to provide that guidance and support for an individual who needs that guidance and support within the context, like I said, of hospitals and within our social cultural institutions, so to speak. We've had very many organizations of men within our cultural organizations which address men and their challenges within the context of living, so to speak. So it's one way that we can look at in terms of how best to start thinking around harnessing that, acknowledging that there may be different ways of challenging some of our mental health issues within the context of being male, being female, and some people may prefer one way as opposed to another, not necessarily ruling out any of them. Yes. Cedric?
Yes, Dr. Another question, there are more questions also coming. Can I read for you, Dr.
Yes, and please get in touch with Liz. I think she's putting up her hand somewhere, but yes.
Can a boy's masculinity be affected by being raised by a single mother? Question, the following question, Eric here, can one shift between of any of the three masculinity states with time? Another question, Eric here, can one shift between any of the three masculinity states with time?
Yes.
Another question, father's role on the son concept of masculinity. That's how it has been asked. Father's role on the son's concept of masculinity.
Right.
Lastly, homogenic masculinity is unrealistic in current society.
Right.
So that is the last question, Daktari.
That's a comment. Yes, yes, yes. How realistic is hegemonic masculinity in current society? It is almost, as I said, very many people, well, people hardly ever achieve it. And people very often switch from different forms of masculinity, whether it is the hegemonic, sometimes it's with you know, you can, it's a fluid kind of situation depending on where you are. You may become marginalized. You may become marginalized and you may become dominated. And you know, at different points when you're with your boss, sorry, when you are with your boss, for example, the boss may well be male or female. When you are with that particular boss, you can't exactly go about dominating that particular relationship, because that's not how it works. But when you leave there and you go home, you can become a hegemonic, you can approximate the man of the house, who is the strongest, who is the decision maker, and who does X, Y, Z. So that can happen. We alternate between the different kinds of, we alternate in a fluid manner between the different kinds of masculinity. There may be one which seems to be the greater one in which you relate to, but at different points you may need to change to another one. Boys being brought up by single mothers. More and more studies around the world are really looking at this particular component, and there are attributes which young boys do get from fathers, much more so biological fathers. And it's been very interesting just to appreciate some of the things that are developing around the world. The kind of things that men do for the growing young boy tends to be very different from what mothers do for the growing young boy. I'll just give you a very quick example. The roughhousing play that sometimes fathers do with their small children, you know, rolling around on the carpet, they're wrestling, the father is throwing the child up and down and everybody's giggling. There is something which has been appreciated right now. It's called, we're appreciating there's something in the brain called the play circuitry. There's the neurocircuitry for play. It's inherent in all of us. And the way the male tends to interact with the child, and this is why also the fathers needs more education, is such that it assists them to develop this particular circuitry. And one of the core things that it actually contributes to this young fellow is development of delayed gratification. Now, we really don't have much time. I can't really go into that very much, but it would be interesting to go around and read how it is that play helps instill in one the concepts of delayed gratification, which help to strengthen matters of ethical behavior, and which help in helping people just develop the ability to be able to apply themselves to tasks until they get a specific goal. So I've just mixed there the father's role and the mother's role together. And again, I see Liz's hand is up.
Hi, yes, my hand has been up for a bit. I just wanted to take over a few of the questions from Cedric and maybe help in asking a few other questions. I can see Dr. Makanyango is in the house. Hi, Meg. Hegemonic, she asks, is hegemonic masculinity unrealistic in current society? Maybe you could answer that for us according to your research and your studies, Dr. Bukusi.
It has never really been actually achievable. I mean, this is our aspirational ideal, to be the hero. I mean, you know, we only read about these things in comic books and whatever it is. I mean, all the other heroes that we have appreciated within history, throughout history, they have had their own foibles, they've had their own failures in all sorts of different areas. But the actual utter hegemonic man, the person who supposedly has it all, well, has never really existed, so to speak. However, there are people who, at the end of the day, have a significant number of those particular attributes. Tall, what do they call, the women call them tall, dark, and handsome. They have the brains, they've got a job, they have the strength, they have the money, and quite a number of people do come through with that. But then on the other hand, they will have their shortcomings, so they will not be able to, they may be that way and then they don't protect their family. They may be that way and then they are very aggressive against their family members. So we have a mix of the different attributes. But yes, there are those who will come through with quite a number of those particular attributes, and it is the ideal for very many men. But that's what I would aspire to. Even as we said, sometimes they are very quiet in the house and they're like a mouse, but they don't challenge it at all. Okay.
Okay. Well, that's a good answer, especially the tall, dark, and handsome ones. I'm sure the medics in the house, some of them can relate. Dr. Kigamo is also in the house. So he says, congratulations, David, on this discourse. Could you share any information on the effect of culture and sophistication on whether the stereotypical masculinity is changing?
Wow, great question. Yes, the short answer is yes, it is changing. Let's put it like this, just like, for example, I talked about those incel groups and men going their own way, men who cannot supposedly cope with the new empowered woman. There's a growing trend in many of our middle-class societies to try to develop a sense of stable relationships within the context of relating and redefining what masculine behavior is. And I guess what we need to be able to appreciate here is that, like I said, we're in the age of the Anthropocene, we're in the age of where we have agency. So we are in a position, as opposed to in the past where we used to think everything was immutable, we're actually in a situation where we're able to say, look, let's take a step back. What do we actually want to get out of this as a man in terms of us individuals? And quite a number of organizations, cultural and social, religious, have been stepping back and, in a manner of speaking, trying to redefine masculinity and masculine behavior within the context of modernity. And that's kind of where we are. So it's still a struggle. It's not ideal, but the good thing is that it's something that we can attempt.
Okay, thank you for that response. Sylvia Mita asks, what happens to gayism and masculinity? Is there a link?
Gayism and masculinity. Gayism, presumably from the LGBTI scenario. And as we're talking about aspects of modernity where nothing is sacrosanct, nothing is sacred anymore. People are exploring sexual behavior, exploring sexualities, and in different places. One of the reasons, for example, the American Psychological Association, when it brought out the guidelines around helping boys and men, and they talked about being tolerant, about appreciating the breadth of expression that a young boy or a man may bring out. And of course, the traditional traditionalists said, no, that's not acceptable. But on the other hand, we do know right now that there's a lot of exploration around these kind of sexualized behaviors. So a specific direct relation between gayism and masculinity, there's just increased appreciation of sexual expression. Yes, Liz.
Yes. So I'll ask, there's another question from an anonymous attendee who sounds a bit frustrated. Yes. He says men are torn due to women perspectives The feminists want to water down masculinity. Mothers are proud of alpha male sons, and wives will complain of masculinity today and complain of weakling men tomorrow. What should men do?
And this is one of the reasons why we're having more MGTOWs, men going their own way, because, hey, you know, you're damned if you do, you're damned if you don't. So let me just operate on my own, and I'll look to acquiring certain needs as the need arises. So it is a frustrating place. I guess what some men are trying to do is let's look for people with common backgrounds, with whom it will be easier for us to have come to some understandings of a relationship, so to speak, in terms of understanding how a male and a female will relate to each other. Otherwise, there's so much exploration going on with regard to our gender fluidity, and how we relate and what it is that we're looking for in terms of happiness, in the pursuit of happiness, consumerism. There's just too much. So I guess the bigger and this is the confusion that we're talking about, which helps to contribute to this discomfort that men experience and the frustrations they experience. And so it's more like we're trying to say, look, you know what, you as a man need to start figuring out who you are as an individual. And then you can choose whom you're going to interact with. At least that you have some control over. But with the women's empowerment and all the things that they're doing out there, hey, there's not much you can do about that.
Okay. Yeah. I hope that answers our anonymous attendee. Dr. Makanyango, we'll take maybe one more question before we close down. Dr. Makanyango asks again, there is a growing concern about single mother sons who lack that male role model at risk of mental health and social problems. What can we do as a society?
What can we do as a society? Now, in there's a program which started in India, but it has been spreading out around the world. And on International Men's Days, in fact, last year and the year before, they've been really trying to market it. First of all, men don't like getting that kind of information. So even though that information is out there, nobody was actually looking for it, but it is out there. And so what people are starting to do is to develop community fathers. Now, this is not like in the Kenyan media, community husbands. No, this is community fathers. So within the context of a specific residential arrangement, so to speak, or between various relations, say like, for example, you can be living within a court, and then all the fathers come together and say, look, let's work towards helping to father these particular children. Or within a particular family, they say within the greater family, we'll bring together all the men who will be able to provide support for various women. So these are societal initiatives which are taking place, by the way, around the world. And with very good results, by the way. Many of the young people actually enjoy participating in those particular activities. There have been some practices out in Iceland, for example, reducing drinking among the adolescents. Again, it's by bringing together members of that community and having community parenting, which helps in strengthening community values, building the same, and developing appropriate adaptive or appropriate behavior for certain circumstances. So that is actually possible. And those are kind of initiatives that we would hope that would be started. There are a few which are actually going on in Kenya. I know there's one in the Ngong area right now, one of the villages in Ngong, where the fathers are coming together and saying, we are going to provide fatherhood practices for the people around here, whether they have two parents or whether they are children of single mothers. Yeah, so those are what society can do.
Okay, I'm not sure if you answered.
In other words, the Ministry of Social Services needs to get involved.
Okay.
Sorry.
I'm sorry. So I'm not sure if you answered this one. Okay, that was answered. The father's role on the son's concept of masculinity, was that responded to?
The fathers?
What is the father's role on the son's concept of masculinity?
for all intents and purposes, the imprinting of the concept of masculinity is based on this father. And so the father needs to deliberately go out of his way to ensure that reinforces, teaches, guides, corrects what the concept of masculinity is and demonstrate it by his behavior. So it is extremely important for both the boy and the girl, of course.
Okay, thank you very much, David, for this wonderful, wonderful presentation. It has been one of our best attended with almost 750 attendees at one point during this session. Now, I hope we have learned a lot. I hope we better understand what's going on in our current situation as regards masculinity and gender, and especially with mental health taken into account. So I'll ask Peter now to project for us the call center numbers so that we can copy this down. A lot of us are having issues or are having difficulties either coping as regards this topic sometimes, and other issues like other mental health issues, and they need support. So we have a call center for mental health practitioners specifically and their families. And we ask that you call. We are now able to call you back for free when you try and call us. If we see your number, we'll call you back. Our moderator today, Cedric, is one of the people at the call center. His center is populated by mental health specialists, psychiatric nurses, medical psychologists, clinical psychologists, specialists. So please copy those numbers or take a photo or take a screenshot so that you have the numbers saved. You can forward them to anyone you feel is struggling. You can use them yourself. You can have your family member call, and they will receive the necessary support. So once again, as we close, I'd just like to acknowledge all of us who are here today, the participants and the panelists, and I'd like to ask Dr. Josephine Ohas to give a vote of thanks and close our presentation. Dr. Ohas?
Thank you so much, Liz. A big thank you to Dr. Bukusi for this very timely presentation and very informative. And of course to Cedric for walking us through as our moderator, and to yourself, Liz, as well. And a big thank you to the participants. This has been an amazing presentation. I'm sure we have learned a lot, and we have a lot to, of course, apply in our lives, both as men and as women. So thank you so much. Until next Tuesday for our next topic. Good night to everyone. Bye-bye. Thank you.
Good night.
Good night.
Bye-bye, everyone.
Bye-bye. Welcome another day.